Today we are going to be covering the ACL injury prevention program, as well as taking a look at the risk factors and the common causes of an ACL tear. I'm Jack Lemon. I'm a student physical therapist at University of Findlay. I've also been a PTA in orthopedic sports medicine practice, as well as acute care for the last 8 years. And I'm also a certified advanced personal trainer. Today, what we're going to hope to accomplish by the end of this program will be that we'll be able to review the anatomy and the biomechanics of the ACL and the knee, be able to identify common risk factors as well as the causes of the ACL tear. We're going to be able to instruct and carry out an ACL prevention program, and most importantly, to be able to recognize proper body mechanics compensation patterns that the athletes should be complying with during the program. So just some ACL fun facts. An estimated 250,000 ACL-related injuries occur in the United States yearly, with approximately 95,000 ACL ruptures. Now, the incidence of ACL injury is higher in people who participate in high-risk sports such as basketball, skiing, soccer, and football. ACL provides roughly 90% stability of the knee joint. So when looking at the ACL anatomy and biomechanics, you want to become familiar with the knee joint, the body mechanics, and also the anatomy of the knee, because the only way that you're going to be able to strengthen the knee is if you are educated on what muscles, what ligaments, what tendons that you're going to be strengthening in order to stabilize the knee a lot better. So one of the 4 stabilizing ligaments of the knee is the ACL, along with the MCL, PCL, and the LCL. The origin of the ACL is at the medial and anterior aspect of the tibia plateau, and the insertion is at the lateral femoral condyle. So this ligament actually crosses the knee joint, which is why it takes on most of the stability of the knee, as well as the torque force. The action, the anterior cruciate ligament, runs diagonally in the middle of the knee, preventing the tibia from anterior translation on the femur. So this provides the bottom of your leg from translating anterior, which means forward, in relation to the femur. Also provides rotational stability of the knee, in which you'll see why this is very important later on as we continue with the presentation. The ACL, along with the PCL, guide the instantaneous center of rotation of the knee, therefore controlling joint kinematics. So what that means is basically the 2 ligaments inside of the knee control a lot of the movement the knee is going to be going through during any sporting activities or cutting or pivoting. Muscles that contribute to the ACL, provide knee stability during movement, would be the quadriceps, the hamstrings, glute medius, the TFL, which is tensor fasciae latae, abductors, and the hip adductors. So when looking at the ACL description of what actually a tear is, anterior cruciate ligament is a passive stabilizer of the knee, as we said before. It guides the motion between the tibia and the femur, as well as preventing excessive anterior motion. Disruption of this ligament can result in a tear. Now, this can either be a contact or non-contact injury, but most likely and most prevalent would be a non-contact injury. And as you will see here, we have a video that will demonstrate actually a 3D kinematic motion of an athlete.
Typically, the ACL is torn in a deep submovement that produces valgus and internal rotational movements of the knee. This usually occurs in high-risk pivot sports, when the athlete lands on the leg and tries to rotate in the opposite direction. This is seen when landing from a jump or wheelie, changing direction from a great speed or due to a collision, forcing the knee in the opposite direction. There may be an audible snap or tearing sound at the time of injury, followed by the knee giving way. Often the pain associated with an ACL tear isn't substantial until several hours after the activity. In this time, the knee undergoes considerable swelling, causing it to stiffen up, with most of the pain due to the swelling within the joint.
Okay, so as you can see with that video, again, leading back to most of the injuries becoming non-contact injuries, it's going to be a plant and pivot, which is going to be the most common. When looking at ACL grade tearing, grade 1 and 2 are roughly the same when you're considering treatment measures. Grade 1 is the mildest form. Mobility and stability are still there. You're not going to really see any change in mobility or their gait pattern. Grade 2, a partial tear. This is when you kind of start to see some compensation patterns going on when you're walking, moving, getting up from a chair, doing anything that's weight bearing. You can see some maybe grimacing on their face from some pain. Now, grade 3, the most severe, like we saw in the video, this is going to be a complete rupture of the tear. And this is when we go back to the 95,000, are usually complete tears. You very rarely will see grade 2, grade 1, more common in grade 2, but grade 3 is going to be the one that you see most commonly. So looking at the common risk factors of an ACL tear, obviously it'll lead to a weak ACL, which is decreased training methods. When you have a training program that doesn't really focus on knee stability, joint kinematics, you'll see a lot of athletes, especially the females, with the weak ACLs, weak tendons. Joint laxity, which means there's not too much tension in between the joint, which allows the joint to free move a lot more than a normal joint. Malalignment of the lower extremity, so hip, knee, ankle kinematics are not aligned properly. Weak glutes, hip external rotators. These are probably the two most important muscles that you want to strengthen when looking at the proper alignment of the hip, knee, and ankle joint. Poor neuromuscular control, proprioception, playing surfaces. You tend to see more ACL tears when you're looking at turf versus grass, because the players will get their foot caught in the turf and they go to make a planning movement or a quick initial movement from a stopping position, and that's when that tear will kick in. So gender, this plays a huge part. So females are 8 times higher prevalence than males due to the increased Q angle. And as you can see in the picture here, we have the pelvis, which is frayed out in the females for childbearing purposes. The males are more internally rotated. So you'll see the females, their pelvises flare out, which causes the internal valgus stress of the knee. So normally for men, it's 14 degrees, for women, 17 degrees. You might not think the 3 degrees makes a big difference, but as you can see from the picture, the female's already at a disadvantage just from starting athletics. So training this early and catching it early with mechanics is very important. And leading right into that, poor mechanics can lead to injury. As you can see, we have a professional athlete at a pro combine. Correct jumping, landing, squatting, and cutting form mobility are essential to injury prevention. This is RG3, who previously the Redskins and Cleveland Browns. You can see his jumping mechanics. As he goes up, he's pretty well aligned. As he comes down, his knees almost touch each other. And this is a guy that's been training probably his whole life to play football and never focused on really the external rotators. Hip abductors are actually focusing on his knee. He just probably went out and played and trained weight training. And then here you can see girls. This is the preferred, hip, knee, ankle alignment's good. And then you can look at the valgus or abduction. The knee kind of slants in on both sides, and this is just from a standing position. So this is pretty easy to pick out when you're assessing a female athlete. You can ask them to do a squat or a jump, and initially they're going to go right into the internal valgus stress of the knee before they even start a movement for the strengthening purpose. So when looking at the common causes, intense impacts or collisions, which would be the contact injuries, increased valgus force, rotational movements in which the tibia is externally rotated, and slight knee flexions on a planted foot. This is the most common of the non-contact ACL injuries. Then we got the forceful hyperextension of the knee, rapid change in direction, landing wrong from a jump, decreased trunk, foot, and hip angles, and excessive dynamic knee valgus. Now, going through all of this, when you look at the biomechanics and anatomy of the knee, poor training, poor initiation of movement, can this prevent it? Here's RG3, and you can see that this was not prevented in this case. Fact, ACL prevention programs provide a substantial benefit when reducing ACL injuries in males and females, with a risk reduction of 52% in females and 82% in males. Okay, so going forward, so now that you have the background on the common risk factors, common causes, the poor body mechanics, and the weak structures of the knee that can lead to an ACL tear, we went back and we researched the Santa Monica Orthopedic Sports Medicine Foundation, as well as NWO physical therapist David Bierhoff of Findlay, Ohio, and put together kind of a supplemental program that goes off most of their principles here. So the ACL prevention program consists of five components. The first was going to be an active warm-up. The second will be a stretching component, strengthening, plyometric exercises, and then lastly the agility drills. Now it's come to be most effective 3 to 5 days a week. We like to start at 3 days a week just so they can implement the program and make sure that everybody's following it correctly and they're in compliance with everything that's the program entails. Each session should only take approximately 15 to 20 minutes, so something that can be completed easily as a warm-up prior to practice. Frequency or duration can be based on athletes' needs and activity level. Obviously, if you have a higher level of athlete, like a Division I, Division II, obviously college is going to be different than high school. You might want to start on a little higher level of dynamic type exercises. The main component of the program, you can implement the program, but if you don't focus on proper technique and eliminate compensation patterns when they're performing it, you're basically just doing a disservice to the athlete that's performing it and wasting your time.
So worst porn I've ever seen.
Okay, so we're going to get into the actual program details. So the active warm-up, what we're going to do first, so we have the active warm-up, we have 3 components of the active warm-up. One's a line jog, one's a side shuffle, and one's a backwards run. So what we're going to do here is we're going to have a couple of our stellar athletes complete this program. So the first one, so what we're going to do with a warm-up, what we're trying to accomplish is warming up, cooling down, critical part of the training program. Warm-up has been shown to clinically decrease the chance of ACL injury. So all I'm going to have them do is just do a typical line jog, and when you're at the field, you would be doing this from sideline to sideline. So you're just going to run down, run back. Okay. So the next one, the side shuffle. So the athlete's going to face one way, either way, it's fine. And just side shuffle down, and side shuffle back. When you're doing this, what the coach should be looking at is just the proper hip-knee alignment. You don't want to see them shuffling, their knees buckled in, or externally rotated when they're going through it. And the last one of the warm-up is going to be the backwards run. So you're just going to have the athlete turn backwards and just run back. Okay, and the second phase of the ACL prevention program is going to be the stretching. Just a little background, performing stretches in dynamic form. We're going to allow for active warm-up to continue during the stretching phase. So actually doing something while you're moving and not doing a static stretch is going to lead to more blood flow in the muscles, which are going to allow for reduced muscle soreness, reduced tension during the exercise, and increased proprioception during the activity. So the first one that we're going to go into is going to be the dynamic quad stretch. So what you're going to do is instruct the athlete to walk down, pulling back on the knee, try to keep the hip, knee, and ankle aligned with the back so you don't see any winging out to the side. So again, they will perform this down to about 20 yards and then back down. Okay, the next one, we're going to do the dynamic hamstring stretch. So what you're going to do is instruct the athlete to walk sideline to sideline, single leg, bend down, leg up. The same with this. You can do about 20 yards down and back. It takes roughly probably about a minute, minute and a half to complete. Next one is going to be the dynamic inner thigh butterfly stretch. So you're instructing them to walk down, bring their leg up, pull out to the side, stretching the inner groin, inner thigh muscle. Okay. And then the last component of the stretching program is going to be the hip flexor stretch. So you're going to instruct them to go into like a lunge position, hands behind your head, bend back, stretching the right hip flexor. And then when they go into this position, they'll be stretching the left hip flexor. Okay, so that's phase 2. Going into phase 3, which is going to be the strengthening phase. This is going to focus on increased lower extremity strengths, which is going to lead to more stability in the knee joint. Form and technique, once you get to this phase and the later phases, is going to be critical. And this is when the coaches and players must pay attention to the hip, knee, and ankle kinematics of the joint. Okay, so the first one is going to be just a walking lunge. So you're basically going into just a lunge position. And this is good after the warm-up of the hip flexor stretch, because you get that stretched out, and then you can go into performing the walking lunge. Into the bridges and knee extension. Okay, the next one's going to be the bridges with knee extension. Now this is going to work on increasing muscle endurance, facilitating the core and hip stability. And this exercise actually will highlight inhibition or weakness in the glute max. So if you see a dropping of either the alternate or contralateral hip, then you know that that's something that you need to work on with the athletes, like the glute muscle strengthening. It was pretty good on that one. So third, Russian hamstring. So this is kind of a higher level type of exercise, but you can compensate and kind of modify it if needed. So what you're going to do is you have the athlete on both their knees, you're going to have somebody else behind them supporting, and what you're going to want to tell them to do is just slowly fall forward, and then when you feel like you can't hold yourself, just go ahead and brace it for the fall. Now this is going to strengthen the hamstring muscles in eccentric manner, which means you're lengthening the muscle while you're strengthening it, which is proven to be one of the best ways to actually strengthen the muscle because you're recruiting more muscle fibers during the exercise. Then we're going to go into the last strengthening one, which is going to be the single heel raise. This is just a simple standing, single leg, single heel raise. So this is going to work on the stability of the knee as well as the ankle strengthening, which is an important player in the knee joint, and taking pressure off of the ACL. So phase 4 is the plyometrics. So this is when it starts getting into more dynamic movements. The first one you're going to start out with is going to be the forward cone jump. And with these, you're going to want to encourage proper technique, stabilization of the knee. And when they jump, you want to check their knee alignment to make sure they don't have any valgus stress or internal rotation of their hip. So go ahead and jump over the line. As you can see, he's planting, really focusing on the ankle and the knee and the hip joint. So what you're going to do is you're going to do that for 30 seconds, and then you're going to turn and go into the lateral cone hops. And if you have lower level athletes, you might want to start with the double leg forward jump, double leg side jump, and then work into the single leg. But Division I baseball player, I think he can handle the single leg. Okay, so then the next one we're going to go for just a vertical jump. So what you're going to do is you're going to instruct the athlete to go into like a semi-squat position and then just jump straight up to the ceiling. Just don't jump too high. And then focus on the landing. So when they go up, you want them to come down, land into like that semi-lunge or semi-squat position, reducing the force on the knee. And as you can see, his knees didn't go past his toes. He had good, no valgus stress, so he's good on that one. Okay, and the last one for plyometrics is going to be the scissor jump. So what they're going to do is start out tandem stance. They're going to jump up and then land into like a lunge position there. And what you're going to want to focus on is that hip, knee, ankle alignment's proper. It's not going past his toes. It's dropping down. His back staying straight. He's not compensating. Let's go with that. Okay, and the last phase of the program is going to be the agility phase. Agility is defined as the ability to move, change direction, and position body effectively under control. So as we've seen in the PowerPoint, the most common cause of the injury is a planning and turning motion. So with this is going to get the proprioception and the correct mechanics down and strengthening the right muscles, external rotators, the glutes, quadriceps, co-contraction with the hamstring to initial that more stability in the knee joint. So the first one is going to be a forward run with a 3-step deceleration. So since we don't have that much room, just kind of do like a jog, and then you're going to do a 1, 2, 3, and then a stop on the knee. So he's going to do run with a 3-step deceleration. So as I've seen, if we had more room, they take off fast, and then the whole point is trying to control a 3-step deceleration and then focusing on the stop pattern with the knee joint kinematics. Let's stop there. Okay, second one is going to be the lateral diagonal runs. So this you're going to instruct the athlete to run forward to one cone. He's going to plant on the left foot going this way because of how the cones are set up. So he's going to run forward, he's going to plant on the left, then turn it to a side shuffle down to this cone. He's going to plant on there, and he's going to turn, and then side shuffle down to this one, and then run back to this cone. So this is going to focus on, basically, when he's running forward, he's going to focus on the stopping pattern so that he has the knee stability, and then he's going to focus on pushing off where he's not doing a twisting motion. Stop, plant. Good. So again, with the change of direction, getting the proprioception and the neuromuscular system working to do the change of direction during the sport. Okay, and the last one of the agility is going to be the bounding run. So this you're going to just instruct the athlete to kind of do like a jog, and they're just going to run and do jumps up. And when they come down, you want them to focus on the landing part, where their knee is staying stable and their hip and knee and ankle alignment's proper. Good job, Bobby. Then lastly, if they would like to go through 15-20 minutes will probably be up. If they have extra time, or if this is something that they're doing during a preconditioning program, they could bring out the agility ladder and do agility drills as well as that. So that's the gist of the ACL program as we went through. And here is the before and after. This is an 8-week program that was done in Santa Monica of a girls soccer program. As you can see, the before picture, we got the 26-degree knee collapse, hip drop to the opposite side, which is demonstrating weak glutes on this side. So after the program, with all the 5 phases, we can see a nice knee, hip, ankle alignment, neutral pelvis. Still a little bit valgus collapse, but this is when she's going to be planning to make a movement, so that's normal. Okay, and here are the references for the presentation. Contact info, Jack Lemon, SDPT, PTA, CPT, Jack Lemon at acmchealth.org, and there's the phone number. Any questions?